This long muscle here,
It's the sartorius.
sartorius, is a 1 or 2 joint muscle? 2, because it's crossing the hip, crossing the knee on the medial side. So it's giving me, if this pulled, what was it gonna do? Flexion of the hip, what else? Flexion of the knee, what else? It's doing that. External rotation and abduction. Watch my arm. Watch my arm, what it does.
Oh, yeah.
See that? Okay, so flexion of the knee and the hip, abduction, external rotation, and flexion. All of that. It all culminates to do the Taylor sit, which is what it's named for. So sartorius. Everybody remember what the manual muscle test is for it?
Yeah.
What do you do? Yeah, you slide your heel up the opposite leg and hold it. All right, so then what is this muscle right here? This short little muscle right here. Yes, that's a tensor fascial lata going into the IT band. And we said the gluteus maximus also, see the fibers there? Feeds into that as well. All right, so this muscle, based off of where it is going to lend itself to do what? Abduction with flexion, because it's anterior, more so than the gluteus medius. All right, so abduction with flexion. And then this muscle here is going to be what? This femoris is a 1 joint or 2 joint muscle? 2. So it's crossing the hip. Yes, so it pulls the knee into extension, but also assists with hip flexion. Okay, so this muscle here. Yes. So iliopsoas, iliacus portion, and then the psoas. So it's connecting to the lumbar spine on the anterior side, which means that a reverse muscle action for this muscle.
That would be, that's the one in the book.
Trunk flexion. Everybody see that? What's pelvic flexion? Oh. Okay. So, yes, so it's allowing you to go into, really, if it's doing pelvic flexion, then it's going to be more of a, yes, I'm sorry. I was visioning it in my head, but yes. Thank you. So yes, it's allowing for this to occur. Okay, with reverse muscle action. All right. So hip flexion, it's a 1 joint muscle. It's only crossing the hip, except for this portion, which crosses multiple joints in the lumbar spine. Okay, but primarily the insertion moving upward is going to give you hip flexion. Okay, everybody remember the muscle test for this?
For the iliopsoas? That's Thomas.
Yes, that's special test for lengthening. But what's the manual muscle test for the hip flexion? Yeah. Yep, that's the strength test. To do goniometry for hip flexion, what are your landmarks? So here, not up here. Here. Make sure you're dead on it though. You just right here. So you're gonna feel, you can feel that. How would you know that you're on the greater trochanter? Yes, you can palpate and do the internal external rotation to make sure it's underneath your fingers. Get your axis there, and then the stationary arm is doing what? Midline of the pelvis, and then the moving arm is following down to the lateral epicondyle. Okay, and we're looking at flexion that way. All right. Let's look at the medial side. So this, let me take this out. Doesn't want to come out. All right. So, what is that muscle right there?
That's the
Pectineus muscle. And then what would be underneath that or lower than it? Brevis.
I thought that was on the other side.
And then the longest, and then the one that goes all the way down, Magnus, and then the one that really goes all the way down, Gracilis. So the Gracilis is going to go from here on down to the medial aspect of the tibia. Okay, all of those are primarily going to give you adduction. All right. With the adductor magnus, we said that there is a space in it at the bottom. It's like a little triangular space again that allows the femoral artery and the femoral nerve to pass through it to go where? Yeah, to the popliteal. So it changes names. What is this ligament right here?
Is the ilio
Somewhat inguinal, yes. So above the inguinal ligament, these are the external iliac vein and nerve, and below the inguinal ligament, it becomes the femoral vein and I'm sorry, not nerve, but femoral vein and artery. Yeah. Okay. Let's see. On the lateral side, what is this? Medius. And then what lies directly underneath it? Minimus. And that's going to give you abduction. And then the minimus is going to give you internal rotation. Okay. And then, boy, oh boy, we get to posterior side. Big guy right here, gluteus maximus. That's going to give you what? Hip extension. This square one is the square one. Quadratus. Quad for 4. Quadratus femoris. Okay, where would the piriformis be? She been saying it the whole time. She was like, yep, I know that one. I don't know anything else. I could give you number 5. All right. So number 5 right here. Piriformis. And we know it's that because what? What do we see right here?
Sciatic.
This is a sciatic nerve. Yeah. It's just going right through it. Okay. Which one is the obturator externus? Yeah. So we really can't see it on this model. It's kind of this because it's as it wraps around, it's on the outer aspect of that obturator foramen. So imagine there would be a hole right there. This is on the outer surface, and then the obturator internus is the one that we really can't see, but it's on the inner aspect of the obturator foramen. Okay. Superior and inferior gemelli, where would those be?
The 7A and B. 7A and B.
Yeah. So then that would probably make this the obturator internus.
Yeah, it is.
Yeah. Okay. So y'all got this.
Yeah, that was
Listen. Okay, so the hamstrings. What are we dealing with the lateral aspect? On the lateral side, biceps femoris.
Tendinosus nervosus.
Yeah, so let's yeah. So then this would be the long head, right? And then the short head lies. And then we got the membranosus and tendinosus. Which one sits more lateral?
Membranosus.
I mean, more medial. Tendinosus here, or
Membranosus. Membranosus, tendinosus.
okay.
So it'll be membranosus.
So membranosus most medial.
Yeah.
Okay, and all of those are two joint muscles connecting on the ischial tuberosity, which we really don't have a good example of, but ischial tuberosity, and then along the medial aspect of the knee, the biceps femoris on the fibula, the head of the fibula, to give you knee flexion and hip extension. Okay.
Would you say this more for beneficial for practical?